Niger Vice President Kashim Shettima don urge the global health partners and other stakeholders for the health sector to support the new leadership for the health ministry to actualize President's vision for all Niger people. Oga Kashima talked this one when he received delegation from the Global Health Partners, the Global Fund, U.S. President Malaria Initiative (PMI), and the U.S. President Emergency Plan for AIDS Relief (PEPFAR), wey pay courtesy visit come the presidential villa. A courtesy talk say President Tinubu na man of vision and say he get courage to follow anything wey he believe, and say the Minister of Health na man with ogbonge credentials wey dem don celebrate for public health practitioner with experience, exposure, and commitment to drive the change wey we dey look for the health sector. Minister of Health and Social Welfare Professor Ali Pate for in talk with Tori People come talk say the visit of the Global Health Partners na to take stock for the progress wey dem don make and come reassure say Tinubu administration dey committed to the effort to fight HIV/AIDS, malaria and tuberculosis among others.
This visit symbolizes the confidence, the alignment that our global partners have around the vision of our President Bola Ahmed Tinubu, and his desire to transform Nigeria's health system to improve the health and well-being of Nigerians. The two visitors, three of them, have now committed almost $2 billion in grant financing for health of Nigerians over the next 3 years. That's a remarkable commitment, which shows they are confident on the vision of our president and the approach that we have now taken to deliver on that, along with state governments and local governments. And all Nigerians will need to put hands together so that we move the health sector forward as a basis for transforming our population to be very productive and to achieve the prosperity that is certainly in our future. It's not easy, but I think we appreciate the visit from these visitors that have come to see us and see His Excellency the Vice President on behalf of the President of the Republic. The second thing that we discussed with them is training of frontline health workers. We're developing a program with them to retrain 120,000 frontline health workers in Nigeria, in all the states, over the next 12 to 18 months. These workers will be trained, who will serve population in the grassroots through a primary healthcare system that we have, working with the state governors and local governments. That's an important contribution to build Nigeria's healthcare system to be more resilient, to deliver on HIV, on TB, and importantly on malaria, because malaria affects our people. We know that there's a problem with the burden of malaria in our country.
U.S. Global AIDS Coordinator Ambassador John Ikengason, Peter Sands of the Global Fund, and David Watson, President's Malaria Initiative, come talk say the visit joined with the commemoration of U.S. government's 20 years of support to Nigeria fight against HIV/AIDS through the PEPFAR initiative, and say the federal government don't do better thing for their fight against malaria, HIV/AIDS and tuberculosis, and them go join Nigeria government for the fight.
We are here to lend our support to the new administration in the fight against HIV/AIDS, tuberculosis and malaria. We have a strong partnership with the government of Nigeria in all three domains, especially in the area of HIV/AIDS, which I oversee. And over the last close to 20 years, we've invested about $7.8 billion in supporting your fight against HIV/AIDS. We want to assure the government of Nigeria that we will continue to work with them under their leadership as they chart a new direction for the health outcomes in the country. Over the last 20 years, we've invested that amount of money in Nigeria, and we are committing another $400 million this year, and subsequent year another $400 million, making a total of about $800 million over the next 2 years in supporting the HIV fight in Nigeria.
As Ambassador Nkengasong said, we are absolutely committed as the U.S. government to align behind this new administration and support their efforts to accelerate progress on but not only the three diseases that we represent, HIV, TB, and malaria, but also holistically, overall, how can we help Nigerians achieve greater health overall? I happen to focus on malaria, which, as we all know, is a very significant problem in this country. Nigeria has the distinction to be one of the biggest sort of burden of malaria in the world. And so what that represents for us is such an incredible opportunity to help align behind this new administration to really accelerate the progress that has been made over time, which has been significant, but really clearly significant opportunities that we still have to collaborate and to move forward. We've been involved in Nigeria from the U.S. government perspective in the U.S. President's Malaria Initiative almost since the beginning of the U.S. President's Malaria Initiative that was founded by George W. Bush. And we've contributed almost $1 billion over that time. And so we're involved in 11 states, along with our partner, the Global Fund, who's involved in 13 states, really thinking about how we can get commodities to people. So the medicines, ACTs as we call them, the rapid diagnostic tests, the bed nets, the indoor residual spraying, the insecticide that we're spraying. So what we want to try to do is twofold. Number one, we want to protect people from ever getting malaria, right, by protecting them from being bitten. But number two, if they do get malaria, we want to be able to have rapid diagnosis, so quick diagnosis with a rapid test, and then treat them as quickly as possible to try to prevent the complications of malaria, which can result in death for the two most at-risk groups, which are children under 5 and pregnant women.
The purpose of this visit is to demonstrate and underscore our commitment, and not just that of the Global Fund, but in deep collaboration with our partners at PEPFAR and the US Presidential Malaria Initiative, to support realization of the vision of this new administration when it comes to health. So we've been meeting with the Honorable Coordinating Minister for Health, Dr. Ali Pate, and discussing his priorities and how we can align behind those priorities to make them happen. Nigeria is the largest recipient of Global Fund financing of any country in the world. And we are in the process of designing programs and committing about $1 billion that will be provided by the Global Fund to Nigeria over the next 3 years. These programs include HIV programs working in partnership with PEPFAR, malaria programs working in coordination with the Presidential Malaria Initiative, and of course with the government itself, and also TB programs, where Nigeria is the country with the biggest TB burden in Africa. But also we are investing heavily in the key components of the health system, whether it's community health workers, disease surveillance systems, laboratories, or the provision of medical oxygen. So the scale and breadth of the Global Fund's investments in Nigeria provide critical support to delivery of the minister's priorities.
Malaria is a major public health concern for Niger, with estimated 68 million cases and 194,000 deaths sake of the disease for 2021. And Niger gets the highest burden of malaria globally, accounting for nearly 27% of the global malaria burden. Other ogbonge people waiting for this visit now, Director General of the National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu, U.S. Consul General in Lagos, Will Stevens, and the WHO country representative, Dr. Walter Kazadi Molobu, among others. Make una not forget say, as we see am, now so we dey talk am, we know they take blame. From TMC TV studio, A. Carter Ojesele, TMC TV News.